Right. Now we are going to today we will be talking about the third portion of the examination of the abdomen. The first was examination proper. The second was the hernial orifices, and the third part of the examination is the rectal examination or the perineal examination, if you want to be more precise about this. Agar, so most of the time, if you're working in your clinics, so you always would find out that the people who are sitting in your clinic would tell you this, that due to social reason, per rectal examination was not done. And most of the time हम ये समझते हैं कि अगर सोशल रीजंस की वजह से नहीं कर सकते तो कोई बात नहीं, ये पीआर ही तो है, सो वी जस्ट डू अ पर रेक्टल एग्जामिनेशन. सो उसके बीच में जस्ट कंप्लीट द एग्जामिनेशन ऑफ द एब्डोमेन, एग्जामिनेशन ऑफ द हर्निया, एंड वुड जस्ट से in due to social reasons it is not possible. Now today we'll be just talking about is it really a rectal examination, or is it important to do it? Most of the time patients coming to your clinics, your private clinics even, you are shy to ask them to get this part of the examination. You do the abdominal examination, you do the hernial orifice, but you do not do the rectal or the perineal examination because of social. Maybe to some extent, yes, that is true. But today's lecture, we're going to talk about something. So we need to have a place, a proper place that, like exactly the way I've been talking in other lectures, that you need to first be prepared for examination. So you cannot do it this examination anywhere on in your room. So you need to have personal protective equipment. Especially, you need to have a mask or a goggles or a face shield, because you're going to examine with all kinds of diseases coming up. So we need to be very careful. You need to have examination or surgical gloves. You need to have a proctoscope of appropriate size, should not be broken. The tip needs to be very what you can say, smoothly aligned. Flexible or a rigid sigmoidoscope would come in handy. And then you can have hemorrhoidal guns, you can have punch biopsy forceps, you can have snares, you can have simple things that if you find there, you can easily convert a diagnostic part of the examination into a therapeutic. Now you need to have 2% xylocaine gel, you need to have gauzes, good lighting, hand sanitizers, and punch biopsy forceps. Talking about the position, remember this is the position, the lithotomy position. This is given in your Bailey and Love. A, a very nice position. Why? Because it gives you very good access. It can give you very good ideas how to approach the area. Very clearly shows the pathologies and the description that you're going to make at the end is also made based on this. So whenever you say that there is a swelling at 3 o'clock position, so that is meant by a lithotomy position. So if my report says that there is an ulcer at 6 o'clock, so that would be this area. And you always know whether you do the examination in any position, but you always know that this is the site of the pathology that I'm talking about. So this is the standard of to do. So lithotomy position, and always when you're doing it under anesthesia, so you prefer to do upper rectal examination while in lithotomy position, so the patient can be easily examined for the vagina, for the perineum, and the genitalia for the in males. The second position, commonly written in your books, is the knee elbow position. Again, give you good access. But if you look at the reporting part, so everything is upside down. So you find a lesion that is at 6 o'clock position on lithotomy is now at 12 o'clock position. And when you are going to mention this, you need to be very careful. What do you mean by this? This position, though, is recommended by many books. Personally, I have seen patients struggle if they are obese, if they are pregnant females, they cannot go into this position for a very long period of time. And it is in this you need to just bend your elbows and your head with the and on a small pillow on the bed. If you see at the back, the foot are down, so you are standing here much away from the area of your inspection, and but the lighting can be very nicely done and therapeutic procedures can also be. What we used to do instead of doing a knee elbow position is ask the patients to do a sajda, because it is very commonly done among Muslims. They know most of the religions, or people know how do Muslims do sajda. So though we ask them to do a Sajda position. This is not written in any book, but this is actually a small modification of what is being done. It is acceptable to many because, and it is very easy for them to understand. For them to understand, the problem with the examiner remains the same as they do with the knee elbow position. You are away from the patient, so the patient is not very comfortable. You cannot cover this the whole of the patient, and the patient have to take their pants off. So again, a useful method which can be used. The third and the most commonly used, or the fourth and the most commonly used examination is the right lateral position. Sorry, is the left lateral position. In this, if you see that the patient's back should be off the edge, so this is again important. Patient, you would see while examining that the pillow lies here and patient comfortably lies here with the back going like this and legs straight. Now, this you cannot examine. This is a very poor position, and you cannot examine the patient and specifically if there are fissures deep down under or a small pilonidal sinus. This is not the position that you are going to be able to see all those areas. So always remember that when the patient is in this position, the back or the buttocks have to come off and there can be a small pillow placed under a small pillow or a rolled sheet placed under the buttocks on the left side of the eyelid bone so that the area becomes more prominent. So all of these position. What I usually do or you recommend is the right left lateral position. Why? Because it is easily done. Patient are comfortable while lying in this position, and you can easily sit and do all the procedure for as long as you want. Is not an awkward position, and you can cover the patient up, and only the buttocks remain exposed. Again, you can use a sheet with a hole. It's very useful, and patient are, I think, more comfortable in this. You need to sit on a stool while looking at the patient, and you need to do the inspection. And you need to remember this slide. Just start with. So we need to do now the inspection, then the digital rectal examination, then we'll do the proctoscopy, then we will examine the genitalia, and we'll then end with writing the report. So, what are we inspecting? We are inspecting lots of things. Do not just put your finger in because there are lots of things that you need to be done, and this whole thing is very important to understand. Inspection.